Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back to our next installment of the Turd Nerds. We left off with this massive cliffhanger by Dr. Rebecca Sand, where she was talking about endo, and she was just about to tell us about endo and the microbiome, which frankly I think is going to rock my world.
And the botanicals that you
Totally.
found. Yep.
Totally, we can do that. Alana, you're really good at building people up.
Yeah, no, seriously, I can't wait.
I do think I have some cool data today. So, endometriosis and the microbiome is what we're going to be talking about today. So, the first thing I want to bring to the table here is this concept of the bacterial contamination theory for endometriosis.
This sounds so Western medicine. I promise you the Chinese never, or Ayurvedic, never came up with anything like this.
Yeah, brand new.
Yeah.
Well,
Brand new
maybe
concept.
they did, but it would be called something different
Like
than the
external
bacterial
pathogenic
contamination.
I know, it sounds kind of like a sewage treatment.
Right.
Something.
Yeah.
Yeah, okay. It might be kind of similar. But, okay, so this is basically immune activation, cytokine-impaired gut function, altered estrogen metabolism and signaling, and all of that kind of coming together to cause this irregular cell growth.
Okay,
that
wait.
we see.
So your immune system's not working. You've got a bunch of contamination.
System is overworking.
So it's like autoimmune.
Well, it's activated.
Okay.
Yeah. The immune system gets involved.
Okay.
In this
And what was the
process.
third thing?
We've got cytokine-impaired gut function, so that like motility stuff I was talking about before, altered estrogen metabolism,
That makes perfect sense.
and signaling of the estrogen, and then we get irregular cell growth. So all of that playing together.
Okay.
Basically, what this summarizes to is the microbiome influences endometriosis via inflammation and dysregulation of the immune system.
I feel like every disease comes back to just that.
You know, it's a good place to look,
Yeah.
I think.
Yeah, I would agree.
Okay, so then, like I mentioned in this first episode, in turn, though, endometriosis can make the environment for your gut less favorable. So not only the gut, it does this to the ovaries, it does this to the peritoneum, it makes things inflamed.
Yeah.
And that's important, and it does that by releasing inflammatory cytokines. They then travel from the peritoneal cavity to the gut, suppress gastric acid secretion,
Oh my God, so
no.
they're traveling up to the stomach.
and affect gut motility.
Dude.
So this is why we need to care about this.
You're talking about the cytokines.
Yep,
Okay.
the inflammatory cytokines that are
Okay.
the result of endometriosis.
So in addition to hypochlorhydria being caused by H. pylori and age, we should also think of endometriosis. Cytokines.
Yeah.
I mean,
or
that's-
really any inflammatory condition.
Yeah.
It's like we're all connected.
I mean, it is like we are basically a tube with crap ton of bacteria with arms and legs to walk us around and feed us.
Yep. Just brace yourself here. I have so much I'm about to dump on you. Okay. Also in this picture, LPS.
Oh, yeah.
Okay, so LPS is the most abundant antigen on the cell surface of most gram-negative bacteria.
Oh, I don't think I ever knew that.
Yeah.
It's just when it gets out
Yep.
of the gut
Yep.
that it's causing...
But that's where it's coming from, is gram-negative bacteria. So when we're looking at people's poop and what's in there, for example, there are more gram-negative bugs in the intestines of folks with endometriosis.
Huh.
So high LPS.
Okay.
Retrograde menstruation will then move that LPS from the uterus to the peritoneum, triggering immune system dysregulation. So that's sort of the basis of what's happening here.
That's crazy.
It's crazy.
Yeah.
I know. Alien.
Yeah,
what I
literally.
keep saying.
That's what you keep saying. That's actually what you keep saying.
I don't think I'm going to describe it like that to patients. Though, but I'm going to take a different avenue.
I mean, I feel like patients are not anxious enough.
Yeah.
So they
Right,
need
we
to
should,
know that there's
especially
an
during the
alien.
last few
me
years,
telling
I
them
feel like
that-
everyone's way too relaxed.
Yeah, you have an alien living in your intestines and your
Or no, it's your whole
abdomen.
body.
Yeah.
Maybe your brain.
In
I've
fact,
learned.
it travels.
Yeah.
It travels. Yeah.
And you've got no control, except maybe an OCP, maybe.
The other thing that we want to think about here is how estrogen is metabolized via the gut.
So when I think about detoxification, I think about stage 1, stage 2 in the liver, stage 3 with elimination of the GI.
That's it. Yeah. So we have to be talking about it for multiple reasons.
And it can get conjugated and then deconjugated, right? Depending on what's going on in the microbiome.
That's it. Yeah, beta-glucuronidase is the one we're talking about there. Yeah. So, okay, so let's start with the bugs. Back to the microbiome. Folks with endometriosis have actually more diverse microbiomes.
Oh.
Is that what you would have thought?
No.
Yeah. Me neither.
That's not what I would have thought at all.
Diverse in unfortunately favoring some of these
diverse
more
in a bad
pathogenic-
way. Yeah, this was a 2021 study. And the thought is that this enhanced variability is what might induce the altered immune response, ultimately contributing to the pathophysiology. So in this diversity, here's what we see. Lower levels of protective lactobacillus species in the gut, higher ratio of Firmicutes to Bacteroidetes.
Higher, so more Firmicutes and Bacteroides.
That's it.
Okay.
Higher levels of gut bacteria that are known to cause BV.
Huh. Like Gardnerella?
Yeah. And then more folks in the stage of the stage 3 or 4 of endometriosis group had Shigella and E. coli dominant stools.
Okay, so that you just listed stuff in their bowels.
Yeah. This is microbiome.
Huh.
Yeah.
Not vaginal microbiome.
So right now I'm talking about like
connected.
a lot of correlation.
Yeah.
What
Not a
we're
lot of causation.
seeing, yeah, what we're seeing in the stools of folks who have endometriosis. Okay, so now I'm going to get into some like really weird, cool stuff that we're learning about this, studies that have come out recently. So this was a study 2023 out of Baylor. Researchers found that mice lacking a gut microbiome had smaller endometriotic lesions than mice with a microbiome.
Yeah, you know what the problem with that study is? Who the hell, like, to be in an environment where you lack a microbiome,
right? But it's
like,
telling it's like this is the beginning of the study. I have more data on here, but it's telling us like how much of a percentage.
They're probably looking at how
and
big of an effect.
treatment-wise, what kind of effect we get in addressing the microbiome. So, furthermore, when the microbiome-free mice received a gut microbiome from mice with endometriosis, the lesions grew just as large as those who had started with a microbiome in the first place.
Okay.
So it completely normalized it. And these findings suggest that altered gut bacteria drive disease progression. So that was sort of the summary of that.
Huh.
So may not give it to you, but will drive progression.
I mean, yeah.
What's interesting, though, is the uterine microbiome did not affect disease progression at all.
Huh. Now that is interesting. Yeah. I mean, can we just recap that for 1 second?
Yep.
What you are saying is the microbiome that is within the vagina and the uterus had no effects on endometriomas, but the GI bacteria did. That is insane. And luckily, under our umbrella of turd nerds information.
Yeah, so finally, we made it back to the purpose of this podcast. Okay, the other things to know, and this, I don't know that it's entirely clinically relevant because I don't know that I'm going to start treating endometriosis with antibiotics.
Right.
But we do give antibiotics for a lot of our gut stuff. So I think it's important to know about this. So certain antibiotics reduce endometriosis disease progression in mice.
I would not be able to guess which ones would.
Okay, I think I would guess which ones don't, because I'm thinking about the ones that don't really touch.
I would be very surprised if metronidazole helped.
I would also be surprised if any of the penicillins
I love this.
Because the penicillins are.
I always think about metronidazole as I really don't want to use with anyone.
Yeah, it's a rough drug.
But I'm now wondering if it...
Yeah, and my guess is the penicillins also would have no impact because they're pretty microbiome neutral, relatively.
So I don't know.
Azithromycin might help because it's
Penicillins.
anti-inflammatory.
And it lengthens the telomeres.
Should we get to some down? I mean, I love the speculation. Speculation.
I'm ready.
Okay, this is a complicated study.
Okay.
They did it in like 4 chunks that were kind of like building off of it as they got data from the previous sections and published this giant thing. So bear with me. Basically, background, they gave mice endometriosis via surgery, and then they ran a bunch of experiments on these mice. So they implanted tiny little endometriomas on the peritoneal cavity.
Also known as chocolate cyst or hemorrhagic cyst or complex cyst.
Those are usually on the ovaries, yeah. Okay, so part 1 of this study, they gave mice endometriosis, and then they gave them a broad spectrum cocktail, which included vancomycin, neomycin, metronidazole, and ampicillin.
Oh.
So blasted them with these.
Okay.
And they gave those, I should back up here, they gave them that antibiotic cocktail before they gave them endometriosis. And what happened, so before like the disease kind of progressed, they had smaller lesions in the group who didn't get the antibiotics. So then they gave them the antibiotics after giving them endometriosis, and it worked exactly the same.
It shrunk the lesions?
Yeah.
Or the lesions didn't progress
Shrunk
as
the
much?
lesions.
Okay.
Huh.
So both groups were treated with 21 days of these broad-spectrum antibiotic cocktail.
That would make any human miserable.
I know.
Yeah.
But so does endometriosis.
Yeah.
Also, they found fewer macrophages in mice treated with
So it was
these
metronidazole, vancomycin.
Ampicillin.
neomycin. Yep.
Okay.
Okay, so second part of the study.
Which interesting neomycin is part of the standard SIBO methane protocol.
And vanco,
Yeah, clear out the gut of...
Yeah. Yeah, of pathogens.
Yeah, they picked interesting ones here. So the second part of the study is they stained the tissues to see if there was a change in estrogen receptors, to see if that was sort of what was going on here with the antibiotics. Looking at ER alpha expression, nothing. No change whatsoever.
So it's just the microbiome effect.
Yeah, it wasn't estrogen receptor mediated in the study.
This is
I
cool
could
study.
I know, it was a cool
see...
study.
I'm going to go ahead and backtrack on my previous statement. I could see how metronidazole may help, given it's really good at treating protozoa.
Totally.
So I could see how if there were undiagnosed organisms,
I could
even
see-
non-bacterial organisms, that it could help.
I could see how this is a hindsight is 2020 type conversation.
Do we have money riding on these bets? 'Cause
We don't.
I'd like to weigh in.
All right.
Okay.
Ready to move on.
So next part of the study, they then looked at the diversity of the microbiome. So the lowest diversity was in the endo mice treated with that blast of antibiotics. I just said.
Before or after?
After they were blasted, which makes sense. We just killed everything in their microbiome. Then they looked at the genus level and detected Bacteroidetes in the endometriosis mice, but not in the mice without endometriosis, and not in the mice that were treated with broad-spectrum antibiotics.
And I could see how something like this we talked about how they had diversity, a negative diversity of organisms. So clearing everything out and putting them on a anti-inflammatory diet, I could see how could build up a better microbiome overall, though it does seem like a harsh treatment.
Yeah. Well, the linking back to the LPS here, so Bacteroidetes are gram-negative, non-spore-forming anaerobic bacteria. They're a normal part of our flora. The interesting thing about them, though, is they're higher in folks with endometriosis, and they're responsive to metronidazole.
Okay.
So then the researchers with this information then examined the effects of metronidazole only and neomycin only on the lesions.
Okay.
Kind of trying to pare it down from a four drug cocktail. So mice treated with 21 days of metronidazole only, ectopic lesions were significantly smaller than the controls.
That's a long course of metronidazole.
That's a long course of metronidazole.
Would anyone survive that? The mice
I
did.
mean, yes, but they'd be miserable.
Yep. Neomycin only didn't change anything. No change in the lesions.
So if you're going to give one antibiotic, it may be metronidazole. I wonder if there's studies on a shorter course than 21 days.
Well, yeah, it's a good question. And this was mice, right?
Right. May not translate.
Right. The weirdest part of this study.
It gets weirder.
It gets weirder. This is sort of the end of this study, but basically they did sort of an FMT.
Oh, interesting. With healthy stool or with bad stool?
With endo stool. But
endo
basically,
stool, okay.
I
And the
learned.
rats?
Yep. I learned the word gravage. Have you heard this?
No, but I'm glad I'm not doing
This type of
mice
research.
Yeah, I had to
model
look this
fecal
one up.
transplant.
Gravage. So oral gravage of feces.
So it's basically...
Oh, they gave it orally
They fed each other their poop. So
to the mice.
Yeah.
Okay.
disgust.
Oral
That's what I'm feeling
gravage
right
I
now.
mean,
feces.
that's what they're in trials, right? There's for human in capsule forms.
Yep.
Yeah.
Gross. Ugh. But
I
yeah,
think
I
it's
mean,
been-
cool
yeah.
science. Okay, oral gravage of feces from mice with endometriosis. So they gave the poop of endometriosis mice to mice who didn't. Restored endometriotic lesion growth and inflammation.
So basically, it comes back to the microbiome.
Sounds like it.
Isn't that wild?
Yes.
So this is not terribly clinical data for us at this
Yeah.
point, but it really tells us we should absolutely be treating the microbiome in folks with endometriosis.
I mean, I feel like where it is important clinically is really if you can start from the beginning to have a healthy, diverse microbiome, eliminate antibiotics, eliminate pesticides, we can do a good, theoretically, if this pans out, of preventing endo in our future
and
generations.
I work with several endo-literate gynecologists locally who send to our clinic for SIBO treatment.
Yep.
Because we get better traction.
Right, because I do wonder about your research on the botanicals, but berberine seems to have good data for so many of these things. I wonder if we could
and
figure
things
something
like
out.
PCOS, there's a lot of gynecological
Instead of
conditions.
metronidazole.
Do you think berberine is the metronidazole of the
I
herbal world?
I do wonder.
Don't let Big Pharma hear that.
I'm sure they can find an active constituent.
So to kind of like broaden treatment strategies here. So microbiome, no brainer, obviously, and more data probably in the time that this gets published or
aired.
Or if they do a human study at some point, hopefully.
And there are other things. That was just one I really wanted to share with folks. So other things we want to think about: crossover between vaginal and gut microbiome. So in cervical microbiome, Gardnerella, Strep, E. coli, Shigella, Ureaplasma were increased in folks with stage 3-4 endometriosis. So basically, if folks are carrying this stuff, like test from, treat it, because there is an association with endometriosis.
Okay.
Estrogen in the microbiome. This is something we also want to talk about. So multiple studies confirming that the makeup of our gut microbiome can lead to an increase in estrogen circulation.
Where the makeup of this is like the estrobolone. This is like the estrobolone.
Yep. So when there's gut dysbiosis, beta-glucuronidase secretion is upregulated. That we know. Not great testing on that, but we know that in theory. That increases estrogen abundance, feeding endometrial tissue, essentially. So get the gut in order for these folks. And then inflammation is sort of the connector of all of this. Do we need to pause? Any questions about all this? I'm giving a lot of data right now.
Are you going to talk about botanicals?
Yeah.
I'll ask like 5 more times.
I don't know
until
that
we
I
get
have
to
a ton of like studies on the botanicals,
Okay.
Well,
but
you
I
know
can
what?
absolutely tell you what I've been taught.
We can talk theoretically as well.
Can we like do a little case? Because I'd like to bring in a little case.
Sure.
Like one of the things that I think it's really important, the correlation between bacterial overgrowth in the small intestine and endometriosis is pretty massive in my clinical practice.
Yeah.
And so personally, when I have an endo patient that's coming in to see me, I am always thinking what's going on with their small intestine and their large intestine. But I think symptomatically addressing bacterial overgrowth in the small intestine does make a big difference for these people symptomatically.
For sure. For endo symptoms. I've had people, anyone with endometriosis who comes into my office leaves with a SIBO test.
Yeah.
That's just how that works, whether they have gut stuff or not, because they're going to get better. Their endometriosis is going to be easier to treat.
And I do think you just painted a really important picture to say the microbiome is one of the things that progresses, like even more than what's happening locally at the uterus or the ovaries. That microbiome is not as important as the GI microbiome.
But I also will, like, even if they don't have a positive SIBO test, it sounds like there's a strong enough connection between bacterial dysbiosis and endometriosis that, you know, why not do a month of antimicrobial botanicals?
I've had one patient who didn't have SIBO.
Okay.
Out of all of your endo people.
Yep. And almost all
So do we even need to test?
Almost all of it's methane positive.
Okay.
I feel like I am always inclined to test.
Yeah.
Mainly because I want to know if I'm going down the right trajectory.
Right.
Like I
so
need
you
a
can
map.
retest. Yeah.
It guides treatment a little bit, like how elevated.
Which ones are elevated and
Do you think it's as valuable to do large bowel microbiome assays?
From this data, yeah. I just always start with SIBO because there's so much crossover and it seems to work.
I just don't think our technology is there with large bowel studies.
I mean, I do think it's better than it was like even 5 years ago.
Yeah.
And it's commercially available. You know, I think what we don't know is, I think what we're learning is species that are specific for different conditions. And my challenge to that is, as a naturopath, we've been talking about dysbiosis for 30 years because
it's not research.
It's not species specific. It's like the whole environment.
Right.
And so then, you know, then I think it kind of brings us back to not only an antimicrobial intervention, but also a lifestyle and dietary intervention where you're cleaning up the things that are just going to feed
stuff
pathogenic.
We would do anyway.
Yeah,
and I think in terms of large bowel testing, like if it's indicated, if your clinical assessment says like it's
but
likely they have it.
But you're saying that you test for SIBO even if they don't have any GI symptoms.
Correct.
So that is like when you are working up an endo case, that is the first thing you do.
Assuming they're like they need help. If they're well controlled on OCPs and they're just fine, I'm not going to test them.
Yeah.
Yeah. But if they're looking for other routes to help their symptoms and get better, absolutely. But also, if someone has like chronic low-grade Giardia floating around in there, I'd want to know.
Yeah.
SIBO test isn't going to tell me that.
Yeah. I am kind of in agreement with you. I do start top down.
Yeah.
So I would start for these patients in particular, just because their symptoms are everywhere from their brain to their pelvis.
At least you can get some data because, like we talked about, testing is difficult. And I guess the other time I think about testing, even if I don't feel like we absolutely need to do it, is if it will help motivate a patient to understand what's going on and have some before and after data, even if I don't think it's absolutely necessary because there's already a high correlation, you know, that it can be used for different purposes.
Yeah. I do feel like, generally speaking, as a clinician, I fall on the testing front.
I like to know what I'm treating.
Yeah.
I hear you. I guess as I get older, I'm becoming more of a minimalist. Like, what is the least we can do to help this person? But I could see both sides of it.
Yeah. I also, and this is SIBO, but I also, like, the test tells me how long we're likely going to have to be giving them antimicrobials.
Yeah. True.
So it
there are false positives, false negatives.
It's definitely not,
it's not a perfect test.
And I will say the other thing to think about with SIBO and endo is the second phase of treatment. That prokinetic phase also seems really important.
Yeah, because it affects motility.
Right.
For sure.
So you could tell the patient, like, there's a very high correlation between SIBO and endometriosis. We could get the data if that works for you. So we have some before and after testing and gives us more of a roadmap. Or if this is not feasible for you, we could treat you.
Totally. I'm also, like, kind of not formally studying, are folks with endometriosis more predisposed to recurrent SIBO?
Oh, that's an interesting question.
And obviously a lot of caveats with that, like, is their endometriosis under control? Like, what's the treatment for that? But I do have, like, a cluster of things that I see as causes of recurrent SIBO. Hypermobility conditions, obviously food poisoning, but...
And hypochlorhydria.
Yep, for sure.
Yeah.
Yeah, and those things, like, I want to monitor more closely, but endo just logically would be on that list.
Mm-hmm. Yep.
So...
Yeah, I would say that tracks for my patients.
Yeah, so monitor. So inflammation, I want to get back to that, and I do have some herbal therapies we'll add in here with data behind it.
Okay, great. So you're going to get to herbal therapies?
It's almost like you want to know what the herbal therapies are.
I feel like when you're talking, this is exactly how I feel. I'm like, what do I do?
I have to keep in my head, like, she might forget. I'm going to have to remind her again before we're done.
Okay, so this one, I'll start with some data here. So controlling the gut release of pro-inflammatory cytokines back to the immune system here can lead to more effective treatment of endometriosis. We know this.
Wait. So I'm looking. So I hear something like that, and I'm thinking in my brain, turmeric, curcuminoids. I'm thinking SPM, selective pro-modulators.
Right, which we're using more now.
Yeah, bromelain. Like, I'm thinking about those anti-inflammatory.
So gut inflammation cascades.
Yeah.
Anything that we use to bring that down. Controlling the microbiome. Yeah. So data we have plant extracts including kudzu vine. Black garlic extract we have data on. They're anti-angiogenic, antioxidant, anti-inflammatory, and we have data on their role in endometrial cell health.
Wait. Kudzu oil. Have we ever used that?
I don't think it was oil.
I don't know.
Did you say oil?
Vine.
Kudzu vine.
Yeah, kudzu vine. I don't use it a ton, but there is data on it.
Okay.
Black garlic.
Black garlic, that's like there's a product.
Yeah, like cholesterol targeted
or
something. Yeah, I don't have that.
I've never used it.
Other things, resveratrol.
Wait, but I will say that I do use a lot of garlic, especially in methane-dominant SIBO.
But that's
it's not black garlic.
Right.
But I do think there's so much data on garlic being anti-inflammatory and antimicrobial. I doubt
it's going to be harmful.
Yeah.
Logic says it's
except
probably
financially.
helpful.
It's always sometimes it's financially harmful.
Right. That one is financially.
So we also have studies on resveratrol.
Okay.
Catechins, which is green tea, curcumin.
Yeah, so I think we call that.
Yeah, and the studies specifically say they can modulate a variety of signaling pathways and have therapeutic effects in endometriosis.
Okay. And they didn't talk about antimicrobial botanicals, like with berberine and such.
Not in that study.
Okay.
Yeah. The other thing we want to talk about is butyrate.
Okay.
Butyrate. I have some issues. You do your thing, and I'll then do my soapbox.
Well, my basic thing with butyrate is giving butyrate doesn't do a thing.
Oh yeah, that's my my.
I've had a few patients self-prescribe it and actually told me they felt it was helpful. But oral butyrate, and it was not. They didn't have IBD.
Maybe that's my issue with butyrate.
Right. So maybe it helps with something.
Yeah, and this was a mouse study, but we know low butyrate's associated with all sorts of things, including like anxiety, depression, and endometriosis
and inflammatory bowel disease.
Yeah, so inflammation.
Yeah.
The gut also is just not going to work right because butyrate feeds the cells we need in
the large intestine.
Yep.
The bacteria, more specifically.
So the study from 2021, and it was a mouse study, upregulating microbiome-derived butyrate protected mice against endometriosis
So that's
progression.
not a butyrate. That is a prebiotic study.
Well,
if it's microbiome-induced butyrate, that is feeding probiotics.
But my suggestion, what I do with my patients, is feed the butyrate producers.
With prebiotics.
Yeah. Yeah, so flax and chia are really good ones. Beans, lentils, high pectin fruits like apples and berries. And
skin,
veggies.
But the skin.
Yep, exactly. Yep, you need the skin.
So treat their
fiber.
SIBO.
So wait, let me
foods.
But
let me
just
just translate.
So they can eat those
Right, that's
foods.
what I mean.
Yeah.
Let me just translate. Fiber.
Yeah.
Yeah.
Again,
forms of fiber. All the different.
Yeah. So that's really the end of the main bulk of the data that I've got. Now we can have a discussion about like treatment strategies, and we kind of recapped that in the last episode. But a basic for me is 1 bowel movement a day at least. We have to be getting that estrogen out. So whatever it takes to do that. Movement, especially in the pelvic cavity. Probiotics, like there's data on this, especially, I mean, there's like human data on probiotics in people with endometriosis. We have that. I don't tend to give it too much. I just don't see them work clinically as well as I wish. Yeah. But lactobacillus and lactobacillus gasseri, I don't know.
Just say it with confidence, it'll be correct.
Avoiding plastics is huge. Diet, I do talk about with my patients, so organic. It's probably very similar to IBD treatment, like what we do in that because it's inflammation. Trans unsaturated fatty acids in red meat can increase the risk of endometriosis. Okay, large amounts of fruit, veggies, dairy products that are organic, omega-3, have attenuated the risk of endometriosis.
Okay. Omega-3s has attenuated.
Through food?
Yeah.
Through fish.
Okay, through fish.
So,
keeping inflammation down.
And then, let's see what else here. So fibers and fats. Herbs that sometimes I'll think about. So I've got whole classes of herbs that I think about. We've got analgesics, uterine sedatives, anti-inflammatories, antispasmodics, and then uterine circulation herbs. That would include like ginger. So just getting things moving.
I mean, I think ginger would fall in a couple of those different categories.
Yep, it absolutely
Anti-inflammatory, analgesics, blood moving.
Yep.
What were the categories again?
So I'll list the categories and some of the herbs that I'll pull from.
Great.
So analgesics, dongui.
Angelica.
Yep.
Angelica sinensis, right?
You got it.
Yeah. Which is in a lot of the women's health formulas.
Yes, yeah. I mean, that's a good that one's for years.
Yep.
Both
and
Chinese
that's specifically anti-spasmodic?
It's an analgesic.
Analgesic, okay.
With an affinity for the female reproductive system. Uterine sedatives.
Cramp bark?
Black cohosh, California poppy, white peony, which is baishao in Chinese medicine, and kava. Those are the ones I use. I'm not like a super trained herbalist with extra. I went to ND school, but these are the ones that I see work pretty well. Anti-inflammatories. So any of the ones we talked about. Also, like curcumin we talked about. Some folks use echinacea. I don't use that one as much because, I don't know. Calendula dongui I also use for that. Antispasmodic. Any ideas there?
Diascorea?
Great idea.
Wild yam?
Yep. That's on my list.
Is curcumin in there at all?
No, but I think, it covers a lot of the options here. Cramp bark, white peony again. Black haw is another one. And then uterine circulation, so getting things moving. Ginger's my absolute favorite for that one. Blue cohosh in that category. Lady's mantle and calendula.
Okay, so are you, when you're putting together these formulas, are you using a little bit of this and a little bit of that to cover all 5 bases, or are you looking at a symptom picture?
Yeah, I look at a symptom picture, and I'll formulate tinctures or whatever for folks, or there are tons of products on the market that contain a good array of a lot of these. Ginger's almost always an absolute no-brainer. For that study on ibuprofen.
Yeah.
That was a post-surgical study.
Okay, can I just tell you guys that study?
Yeah, we haven't talked about it.
It's a great study. It was I think it was like 435 patients. So it was a human study, not very small, where they compared ginger, in particular 6-gingerol, 6-gingerol active constituent, with Ponstal, which is like Midol equivalent, and ibuprofen at 400 milligrams multiple times a day.
Post-surgery.
What surgery?
For pain post-surgery.
Oh, I'm talking about a dysmenorrhea study.
Oh,
this was for primary dysmenorrhea.
Wow.
Yeah, this is a primary.
Okay, so we have multiple studies.
Yeah, this is a primary dysmenorrhea study. And I think the gingerol was 250 milligrams 4 times a day, starting 3 days before your menses through your menses. And then the Ponstal and the ibuprofen were as needed. And it was found that the 6-gingerol was completely equivalent to both Ponstal and ibuprofen to reduce dysmenorrhea pain. Now, again, dysmenorrhea pain is different than endometriosis pain, but we have a study.
Overlap.
I do see. So in most of my folks, I'm trying to get them off the ibuprofen if we can. Like, obviously, if people need pain control, do what you need to do.
And some of them need opiates, so ibuprofen's not cutting it.
Absolutely, but I do get good traction combining a high-dose ginger, high-dose cramp bark, and Tylenol. And it's a lot of pills, and I tell people it's a lot of pills, but we're protecting your gut.
I will also say, like, ginger is very cheap. Like I use a product that's like 500 milligrams of ground ginger, so it's not a 6-gingerol. But it's very effective, and it's like $10 for a bottle of 100.
Yeah. And are people getting the ginger burn that we see with the other motility products?
Yeah, so that is definitely one of the most common side effects of ginger is you will feel like you have heartburn.
Just drink a lot of water.
Stay upright after eating.
Yeah.
I love it. It makes me feel warm. It's like the only time in my
That's
life
true.
that I'm warm.
Yeah.
Go ahead.
You can blend it with cooler herbs too if you want to balance it out.
Good idea. As far as probiotics go, so I agree with what you said. I would say, so I think there's a place for that sort of more detailed-oriented, complex protocols we put people on for whether it's SIBO, SIFO, protozoa. I still do that.
Yeah.
But I feel like we do have a group of patients who that can be overwhelming for. I'm trying to do better at reading where people are with what they want to do. If our sort of standard do all of these things is overwhelming, I have had a handful of patients that gave me feedback on their own over the last several years that spore-forming probiotics have been life-changing for them. Like literally, it worked better than anything else they did. So a modified version of like, let's do this testing, let's put together a protocol, let's take you off of sugar, all the things that I often will do for someone who's ready. An alternative has been, okay, let's get your anti-inflammatory diet as good as we can get it. And let's try a spore-forming probiotic.
Well, this spore-forming probiotics,
in specific
I haven't
forms.
read it, but there's data on that and LPS.
Yep.
Right?
Yes, but
And
the
it can
problem
reduce
with that
LPS.
data set is it was put out by the company that makes
It's
spore.
true. It's true.
And so I will also
Which is why
say-
I didn't jump on the bandwagon until the fifth patient told me this probiotic has changed my life.
I've seen that too. I've also seen it make people worse.
I would agree with
Definitely.
Rebecca.
I don't use the physician grade one for whatever reason of the one we're talking about. The patient formulated one seems to work better.
It's 3 strains versus 5 strains. That's the difference. I will say that I have definitely had some people for the spore form, like it was the game changer.
Yeah.
And I have other people where it
can make them worse. Yep.
And it can make them worse.
Yeah.
Exactly. So it's not like my go-to cure-all, but I feel like it's a first step.
There is a place
we want to
for it.
work on the microbiome. We're not ready to jump into a full dietary protocol, which can be overwhelming for people.
Also, so the one realm I really do use probiotics heavily for treatment of the microbiome is folks who are trying to conceive and folks who are nursing, because a lot of the herbs and drugs we would use aren't safe.
We
and
can't
I
use
do
them.
actually get pretty good traction. So.
Yeah.
As I've been at this. I started my training in 2002, so I've been at this for about 20 years.
Right.
Which is insane because I'm only 25 years old.
It's amazing.
It's really crazy that I've been doing it this long. But what I have noticed is there was like this huge trajectory, probiotics, right? And when I was in school, that like naturopaths were like preaching dysbiosis probiotics.
Yeah.
And then we've done all this literature, and what's happened with the studies, I feel like, is instead of using these huge conglomerations of probiotics, which is what our research was based on in the early early aughts, now we're trying to like pharmaceuticalize.
Right. Find the one strain.
That you can patent, that you can make, you know what I mean? And I think that is why I think a lot of us have moved away from probiotics.
Right.
Because I don't think that works.
Clinically, the results are just not there.
They're not. Like, what comes
I
up
haven't
in
seen it
Cena-
with the regular. This is specific to spore-forming probiotics that I've seen some change with people. I have not seen that routinely with the regular
I see
ones.
some pretty good
love
effects.
Saccularity.
I see that one work probably the best of any, but it's like acute, like if I'm trying to rebalance people without hitting it over the head, I also
don't see people flare with Saccularity.
Yeah, that's true.
Like I see people flare with spores, and I definitely see people flare with class 1.
Yeah.
So probiotics class 1, Lactobacillus bifido, class 2, Saccularity, class 3, spores, which is Bacillus, class 4, E. coli, Nissel.
Yeah.
So those are the 4, when we're looking at the data, we're looking at those 4 classes at the moment.
Yep.
I definitely see the least amount of negative reactions to Saccularity class
agree.
2. However, there are plenty of people who it's a want nothing.
Yeah.
In the spore-forming ones, I've also moved to starting with the ones that have 1 species or 2. I mean, we have all these options, right?
Yeah.
So there's one with just 1 species, there's one with 2. So you can kind of pick where you're going to start. And I don't think people are flaring as much on those as a physician-grade formula.
With the physician-grade formulas, because where I start is the physician-grade formulas.
I'm where the opposite.
What I used to do is I used to have them open a capsule.
And take a little.
Take a quarter out.
Yeah.
You know what I mean? Like, that's what I was doing to get them to settle down.
Yeah.
And at this particular point in my clinical practice, and we all know that changes very quickly, you know what I mean? Like, we're practicing the science and the art of medicine.
Yeah.
At this point, I am like fermented food.
Right.
Yeah.
That would be ideal if
comes with
50% of
tolerate
our
it.
patients didn't have histamine intolerance.
Yeah.
It comes with the fiber though too, and that was the point I was going to make, is if people are just pounding probiotics and they're not eating any fiber.
Yeah, what the hell's the point?
What's
Right.
the point?
Right. You definitely have
You're
to eat
just wasting your
fiber.
money.
Yeah.
Yeah.
We sometimes get in this cycle, like they have overgrowth. They can't tolerate fiber. It triggers the histamine reaction. So
ideally, and then I'm bound to go back to mold. You know, like if I'm looking,
don't talk to me about that.
All roads end with mold.
I mean, I
think a lot of histamine roads end with mold or start with mold.
I mean, I think ideally, if we can get help them tolerate fiber and fermented foods, that would be better than giving them these types of synthetic or whatever derived probiotics, right? And natto in particular is an unusual but interesting food that has specific spore forming.
You like it?
Yeah, I like it. With some rice.
It's really stringy.
I can't remember. It has
like
a very good
things.
probiotic in it, actually. So if you like it, it's a good one.
You know what they call that snotty thing in cooking?
No.
The pull.
Ooh.
Like, you know, because it pulls it. Like, you're like, literally pulling up the polysaccharides.
Yeah.
Yeah.
I mean, I don't know. Yeah, I think it's not bad. I have a couple more herbs.
Okay. And do we have a lot more material that we want to cover? Then we may... Okay, so we'll go ahead and keep going. Okay.
Yep. I have a couple, like, heavy hitters that
Sounds good.
People listening probably are like, why did you not mention some of these?
Okay.
So another class of herbs is ones that help to lower estrogen. They help to kind of balance out estrogen in the body. So in alphabetical order, Achillea, Angelica, Hyssop, Lithosperma, Rubus nigrum, and then Vitex. Vitex is like everyone's plan for me.
So wait. Achillea, which is yarrow, Angelica, which is donquai, right? Lithosperma, what's that one?
I don't remember.
Okay, what else?
Rubus nigrum.
Oh, red raspberry leaf.
Yep, and then Vitex. So Vitex is a huge heavy hitter in this realm because it is a pelvic sedative, antispasmodic, and it is a progesterone precursor.
It is?
Yep.
So it can help even out the relative or absolute estrogen dominance.
I always think of it as a hormonal adaptogen.
That too. So it's not significant enough to really push. It's more botanical version, right? Yeah. But it's not a estrogen precursor.
Yeah.
And we can also use the DIM, indole-3-carbinol, calcium D-glucarate.
Exactly. NAC has very good data for endometriosis. So that's another. It's that and ginger and a SIBO kit is like what people leave my office with. Endometriosis should be just like standard of care for this one. Really good data on that.
So wait, NAC.
Yep.
Vitex. What's the other thing? Ginger, NAC, ginger, and a SIBO kit.
Yeah.
Is your this is where we start.
Well, if they're in pain.
Yeah.
You know, which
so interesting.
Usually is why they come. Yeah.
Yeah. Wow, that's great.
You're not seeing a bunch of asymptomatic people who are...
You know,
and you're like,
I've
go
seen
do
it on
this
ultrasound.
SIBO test.
Yeah, I've seen it on ultrasound, and it'll say, like, complex cyst, and people are getting heavy periods, and I'm like, let's just monitor this. But in the back of my head, you know, I'm obviously keeping track of what's happening.
Yeah.
So... Also, another great treatment for endometriosis before we leave here, pregnancy and menopause.
You know, the problem with
when you
both
stop
of those...
estrogen at menopause, unless you go on HRT.
They're not without the things, I will say.
Yeah, no, I will say pregnancy is a very expensive intervention for
endometriosis. Many years, yeah.
I wonder on the data of HRT with a history of endometriosis, given we're giving lower doses than what they're making endogenously. I don't know. Because you'd still hopefully be able to offer it as an option if they're having other symptoms. Yeah,
I mean, it's not that I know of a contraindication to administering.
It's not, as long as you're balanced,
Yeah, but it's a really good question.
Yeah.
That was great.
Yeah.
That's
lots of info.
Anything else?
No, I think that covers a lot of it.
Okay, can I summarize what I learned?
Go for it.
One, I learned that it all comes back to the microbiome, especially you have... Firmicutes elevated gram-negative flora within the GI when you treat with antibiotics.
High Bacteroides, wasn't it?
I thought it was high Firmicutes.
Bacteroides.
Oh, really?
Yeah, because that's the LPS producer.
There was a previous study with some other imbalances, but I remember that metronidazole worked on Bacteroides.
Oh, no, you're right. Higher ratio of Firmicutes to Bacteroides.
But also higher counts of Bacteroides, right?
Causing problems in there because the diversity is high.
Okay.
I learned that if you're going to choose an antibiotic and you're a mouse who, researchers have really effed with, then metronidazole is your antibiotic
for 21 days.
For 21 days.
Quality of life will be abysmal.
But you are a mouse who lives in a cage, so you already have low quality of life.
So we wouldn't necessarily recommend people go start treating with that at this point. Let's wait for a human study.
The other thing that I thought blew my mind a little bit is affecting the GI microbiome has more of an impact than even affecting the microbiome of the uterus and the vagina.
Yeah, it's a large extrapolation of data here. Yeah. And it also is just common sense. Like, look at the gut.
Right.
Yeah. And then I learned that there's a lot of different herbs that we're looking at using to treat. And then we're also looking at the microbiome connection, which is like fungal overgrowth, bacterial overgrowth in both the small, for sure, and maybe the large intestine.
Yeah.
What'd you get?
It's so much. I feel like I have to listen to it again, but let me see. Focus on the gut. Give them a SIBO kit, or at least think about bacterial overgrowth, given that very high correlation, to help inform your long-term treatment. And there's lots of options if OCPs aren't their preference or aren't indicated for whatever reason.
Or aren't good enough.
There's a lot of botanical nutraceutical options, along with anti-inflammatory lifestyle, diet, movement, all the things that you mentioned, pelvic movement.
Exactly.
All of those things can be helpful just to help change the course of the long-term
progression. Yeah. So I think in my recap, if I can do one here real quick, I treat endometriosis with like a multifaceted approach. So I'm looking at how to slow estrogen's impact on endometrial tissue. I'm looking at the microbiome. I'm looking at healing anything with the microbiome, inflammation, and then movement. Those are the facets I'm looking at. So whatever people are able to tackle and take on, what's doable with their life, what's actually going on with their gut, I'm bringing things in from all of those realms.
Okay.
All right.
That was
Thanks,
great.
Rebecca.
Thank you, Dr. Sand. Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.